Later this month, Oregon voters will have a chance to weigh in on Measure 101, helping decide how the state pays for its Medicaid funding. Well, there's a lot at stake in this January 23rd special election. Tim Becker joined us to break it down for us. Tim, a lot of folks didn't even know there was a special election this January.
Well, I knew very little about it until I was assigned this story, to be honest, Jeff. Last year, Oregon lawmakers passed and the governor signed a bill that would tax insurance companies and some hospitals to provide health care for low-income Oregonians. Opponents thought it should have to go to a vote of the people, though, and they got enough signatures to put it on a ballot. That's why we have Measure 101.
Without Medicaid, we wouldn't have coverage.
Supporters of Measure 101 say it'll protect health care for low-income families, including 400,000 children, as well as seniors and people with disabilities.
Everybody should be able to see a doctor or get the medications they need when they're sick without worrying about being able to put food on the table or without worrying about going into medical bankruptcy.
Those against it,
I think it's wrong to tax a basic human need like health care.
Argue they still support Medicaid but disagree with the way it should be funded, saying the measure amounts to a sales tax on health insurance.
Do you think Providence, who has said that they're going to, that tax is going to cost them $28 million, do you think they're going to just pay for that out of the goodness of their heart? No, it's going to come when your daughter breaks her arm and your copay goes up because that hospital service costs more.
A yes vote would keep the 1.5% tax on insurers, along with a 0.7% tax on certain hospitals. Supporters say it's basically business as usual.
Oregon has relied on provider assessments since 2004 to fund our Medicaid program. It's a federally approved way of funding Medicaid. 48 other states and the District of Columbia use provider assessments to fund their Medicaid programs.
A no vote would force lawmakers to search elsewhere for the $210 to $320 million the state would be deprived of. Opponents of the original funding bill calling pieces of it
inherently unfair, they're inequitable, and they're really not sustainable going into the next budget cycle, because 2 years from now we're going to need to fund more money for Medicaid, and where does that come from? And we should have been focused on a long-term plan and not a plan that taxes other people's health care.
Well, that is just a very basic outline of what the vote is really all about, and we all know health care very complicated, and you can learn much more about this vote online from our news partners at the Portland Tribune. Back to you.
Thanks.